I would like to thank you a lot for this kind invitation to share this challenging case that we treated in National Cancer Institute in Rio de Janeiro, Brazil. And this young lady was 33 months old, and she had initial leukocoria, proptosis, painful unilateral orbital mass, general weakness, and weight loss. Her lag time was 18 months, and she had neovascular glaucoma and periocular inflammation. And she performed and she was submitted to an orbital biopsy, which was initially inconclusive in our ophthalmologists in our institution. And these are her initial images, which had her family's permission to be shown. And this is her initial MRI images, which showed extraocular extension of the left eye with optic nerve involvement and intracranial extension to the chiasm. Then we proceeded an optic nerve biopsy by our our radiologist, and we could confirm the diagnostic and the RB diagnosis, and her molecular studies were possible due to an international collaboration with Dr. Guillermo group, and Sean could show 2P gain, 6P gain, 16Q loss, and 70 gain. And her initial studies were negative, and she was staged by 4B. Her initial management with this multimodality approach was systemic intensive chemotherapy, and her first cycle was based on COG strategy with cisplatin, cyclophosphamide, etoposide, vincristine, plus intrathecal topotecan. And based on this previous paper already mentioned, we gave her high-dose intraarterial chemotherapy through external carotid artery infusion to target the orbit, because she had her ophthalmic artery was destroyed by tumor with carboplatin, followed by infusion through the anterior cerebral artery to target the chiasm with also carboplatin. This procedure was technically feasible, and we did not use the occlusion balloon because we did not have this kind of catheter in our institution, and it was without complications. We gave her the second high-dose intraarterial chemotherapy, but this time with melphalan and carboplatin, and the second systemic intensive intravenous chemotherapy with intrathecal topotecan. And after the third high-dose intraarterial chemotherapy, she developed this complication with periorbital edema, but it responded to the steroids treatment. And then we gave her the third systemic intensive intravenous chemotherapy. And I want to mention that she had this MRI lesion, inflammatory one, without any clinical manifestation. Then she was enucleated, and the histopathologic analysis showed complete tumor necrosis. And then she had her last systemic intravenous chemotherapy and intrathecal topotecan, and more 2 applications in a total of 6 applications of intrathecal topotecan. And at the end of treatment, she was received a sternal beam radiation with 46 grays to orbit and chiasm. This is the image of her radiation programmation. And this is her after 1 year and 3 months follow-up in her last MRI images. And she's doing fine without evidence of disease. Thank you.
Thank you very much, Nathalia. So this would be the third case we know that has been treated with this treatment. So we would like to provide these examples like